I don't even know where to start from, because this experience I'm about to relive right now, it's not something that I would think that would happen to me in that way, but there's a reason why it happened, and at that time it happened. So yes, I'm here to share my testimony, share my experience, and also give thanks to God, because I keep saying it can only be God. Like, if it's not God, I couldn't do it on my own. The doctors couldn't do it if it wasn't for God. You know, there could have been so much scenarios from my situation, from my experience. So yeah, today is not just about tutorial or to talk to you about how a product works or not. It's talking to you about life-changing experience. I don't know, maybe part of me, I'm still a little bit traumatized by my own experience, but I am living daily, happily, gratefully, just thankful to be alive. I need an angel. For those of you who have known me, maybe not really know me, but some of you has been following me for like a long time. When I was doing my talking videos, because my videos is literally mixed. Sometimes I talk, sometimes I do tutorials, sometimes I'm just like talk about a lot of experience. And I do sometimes talk about fibroid. So I talk about my PCOS, what I faced, you know, as women going through PCOS and women going through fibroids and stuff. So it's not something that I shy away from talking. It's not something that I keep to myself. Oh, I don't want people to know that I have this. Keep it a secret. You're a woman. You have to be perfect. You don't have anything. No, the thing is, I learn from other people. So there's a lot of people on YouTube that I have watched their videos that have taught me different things that I've learned from, I've studied. I was like, oh shit, if that could happen to her, if she could share that, mine's not that just bad. So that kind of encouraged me to also share my situation more. And I also believe there's a lot of women also facing my situation, PCOS, or women facing fibroids. And there's so many type of fibroids, you know, inside the uterus, outside the uterus. I can't remember when I was diagnosed, but the only year that kept coming to my head was like 2017, thereabout. 2017, 2016, around those 2 years thereabout, that I was diagnosed with fibroids. It just one day had really bad cramp pain. I was home alone and I took myself to the hospital after 4 days of being pain, heavy, like bleeding, and also in bad pain, and they did a series of tests, concluded I had fibroids. But as at then, they were told me it's just little bit, you have little bits fibroid, about 7 or something, you'll be fine. This is what the doctor, the clinicians, you know, the nurses, whatever specialists involved in the case back then, like, oh, you have small fibroid, it's nothing, it's not going to do you anything, it's not going to affect, you know, you trying to conceive, you know, your fertility issue, you'll be fine. You'll be fine. That's the word they keep saying. So over the course of 2 years after I've been diagnosed and after I've been told you'll be fine, I did a research to kind of like understand what fibroid is, and how do you get it and how do you cure it, and so many research come about surgery, diet, you lose weight, the fibroid shrink, or surgery. And also my option was like, you know what, I'm gonna lose weight, it's gonna shrink, you get me? And then later realizing that, okay, I'm struggling to lose weight, not because my body is not trying not to lose the weight, it's because the fibroid is preventing me from losing weight. Meaning, for fibroid, you tend to add more weight, you tend to like be very big, your stomach area, and it's very difficult for you to lose weight. You get me? It's very easy to put on that weight, but very difficult to lose it. And fibroids is a contributing factor from not losing weight. They're about in and out of my diet, Then 3 years later, I lost my dad. I think I also shared me losing my dad as well. The video is somewhere there. I lost my dad. Then I went back, kind of relapsed in terms of like trying to lose weight. And what else again? Then the years just kept going by. And 2021, I had a stomach pain, and a really bad one. I'm not the type that really get to be sick. I would say my illness only start with like cold and flu, and that's it. And if it's too bad, I just lost my voice, high temperature for a couple of days, and then I regain myself, and my immune system, everything will come back. But in terms of having stomach pain, it's unheard of. It's unusual. What did I eat? Is it food poisoning? Of course, you go to Google to kind of like help you tell you what's your problem. And Google be like, you're having, I don't know, but I can't remember. But, Google will tell you, certain things opposite of your symptoms. It could be your pancreas. No, definitely not pancreas. It's definitely something that in the stomach that do get to burst. If I know the name, I'm gonna just write it here because I can't really think in my head right now because my thought process and my story is just arranged. To try not like deviate from that is kind of like difficult. So yeah, once you Google some of your symptoms, you get opposite of what you're really looking for, and sometimes those answers are scary. It's up to you to know what you want to believe. It's up to you to know this is the symptoms I have. This is corresponding and stuff like that. So, and then you try to like manage that pain, like you take painkillers, like it's pain, okay, pain will go away, and it's refusing to go away. And then you say, you know what, you're not gonna hold this pain for a long time. You're gonna go to the hospital, and you take yourself to the hospital as usual. You always take yourself to the hospital, and then they give you a huge painkiller called naproxen. You took naproxen, and regards to that, you stay in touch with your GP about this strong pain, and your GP book you to have a scan done, like ultrasound, and your painkiller worked. Like, oh wow, this pain just disappeared. I'm telling you, the first time I had naproxen, the pain here immediately disappeared. I don't know how powerful that drug is, but it worked. It disappeared, and I was no more in stomach pain. And of course, I still have to go ahead to do my scan, ordered by my, GP. My scan came back and be like, oh, you have a kidney stone. Again, bad news, but I'm not like, I don't know how to react with something bad news. I just calm, trying to like think about the situation, but don't dwell on it too much because you know what, it's beyond me. I was like, God, kidney stone from where? Oh, again, research, go back to Google. How does kidney stone form? It'd be like, it could be various things, and you don't drink enough water, and if you drink a lot of water, you flush the kidney stone out. So many things. It's unlike me, like I drink a lot of water. Maybe not as much I think I do, but I know I do drink a lot of water. And the cause of the kidney stone situation, again, what is the solution for the kidney stone? Is to get a surgery done. Right, so that is another thing to talk to your GP about. And over this course of in and out, I have like, I go to the toilet frequently, like every 30 minutes, I'm like in the toilet like 3 times. It was really bad as at like 2021, 2022, like frequent urination. And you Google why you urinating frequently, and you have answers like you could be pregnant, you have diabetes, literally that's why you go in toilet frequently. And not to think about your fibroids and making you go in the toilet more frequently, like literally so many things. And then after that, I got a letter from an hospital that did my scan, and the doctor said they want to second that scanning. They don't think it's a kidney stone, so they're going to book me for a CT scan. So I had that CT scan. done. And that CT scan showed, oh, it's not kidney stone, so no, it's a false alarm. It's actually your fibroid is really big. It's gone big. So you need to speak to your GP about it, so your GP can have a solution or whatever arrangement. Hospital have a communication with you, then have a communication with your GP. It's up to your GP to decide what to do with you. But these days, the NHS don't care. Like, I think they've seen so much human beings dying that you become numb to saving lives. They still save lives, don't get me wrong, but like, there's a lot of preventive way of saving lives instead of getting to the last stage of saving life. So like, if there's a situation that is really close that you can quickly solve before it develops more, to me, I feel like they don't care. It's not about just my story, like a lot of people as well, I've seen, I've heard or something like that. So it's like, it's up to your GP to decide what to do to you next. And your GP will never contact you and say, okay, Madam Mrs. J, your fibroid is really big. I'm scared of you. Can we have a surgery done? It's just like a paperwork done and sent to your doctor, and your doctor look at it and kept it and just next. That's it. Never come back to that paperwork. You never have that discussion. You never have a solution. The only way that solution, that conversation comes up is if you go and prompt that your doctor regarding my test result. What is it? What do I want to do? Yes. So that was like 2021 to 2022, and thinking I was waiting for my doctor to like get back to me, nothing. So mid 2022, I decided to like go to my doctor, like GP, like, you know what, I'm gonna get this surgery done. I was told my fibroid is big. I don't know how big it is, but I know that if it's really big, it's cause for concerns. And again, my research on Google and stuff like that, and there's some picture of, frames that you can use to compare different sizes of fibroids. So like, for example, they could tell you it was 10 centimeter. You go Google what's 10 centimeter is. I think as I there I was told it was 14 centimeter. It's the 2022. So again, so my GP heard me and referred me to another hospital who can do the surgery. So that 2022, I had my appointment at the hospital. I think it was a pre-surgery appointment with the gynecologist. I think it's where they go through basics to know if you're fit for surgery. That's my thinking. So getting there, did the blood check, did whatever. I think I went three different departments before actually getting to my gynecologist or so. So when I finally met the lady, she did the ultrasound scan on the stomach. She was, clicking to know how big, what frame, whereabout is the fibroid. And then she went down there inserting with the ultrasound to actually double confirm our first result. And she was like, oh, it's your fibroid. It's gone big. The reason it's big is because your mini fibroids, they've come together to form one big one. So basically, it's not as big as it should be big, but it's only big because the other fibroids have joined together. That's why it's big. So there's no cause for alarm. You'll be fine. Okay, I have pains whenever I have period. Oh, you'll be fine. You can take medication. I'm going to prescribe you a medication, something acid, Trazac, something acid. That will help you with your period pain, with the flow of your blood, so it does not get too clotty, so it will be easy. And your BMI, you keep losing weight, your fibroid is going to go down. You don't need surgery, because it's big, but it's not that big, so you'll be fine. Fibroid does not cost anything, yeah. Quite a lot of doctors say fibroids does not cost anything. And I've heard a lot of stories that people also die with fibroid surgery, that there could be complications. Just depends on how it's done, where it's done, with who is being done. Crazy. That was 2022. So I'm not someone that like medication. I have a belief that if I'm sick, my body should kind of like work itself out, heal me, and I'm good to go. I can only take medication like painkillers like Panadol, ibuprofen, just for certain areas, like if I'm having a migraine or pain. So sometimes my migraine, I tend to rest and to drink a lot of water and just relax. And like, yeah, that's my type of medication. I'm not the type that anything medication. So at first I didn't take that Oxy prescribed for me. Even when I talk about a fertility issue that I've been trying to conceive and it's not working, I should be like, oh, it could be your fiber, but it could not be your fiber, because you have PCOS. So you keep trying, don't worry. And if it's not working, maybe you have to go through the fertility clinic with your partner, blah blah blah. I didn't go to the pharmacy to get my prescription for those medications she prescribed for me to take when I'm having bad period pains, because I don't just want to take medication so that my blood will be easy. I just want not to be in pains, and that is stopping me from being pain. So come 2023, around May, before May, early 2023, like February, March, I went to my GP. I said, you know what? I know the last time I tried to do the surgery, I had a pre-surgery assessment, but the lady said, oh, I'll be fine. It's my mini surgery that came together. They're not supposed to be big, but they're only big because they were just coming together. Now I want to actually take my surgery. So at that time, she kind of scared me. Okay, she kind of like talked me out of it, surgery. So now, after 2023, beginning of 2023, I kind of made up my mind that I want to get it done. So before they refer me, I spoke to somebody. I don't know if it's a clinician, if it's an admin person, and the lady, she was being nasty to me on the phone. She'd be like, yeah, you had that appointment last year. The reason why they didn't go ahead with the surgery was because there's a fear of death because of your BMI. So basically what she was saying is, if I get the surgery done, or if I had gotten the surgery done, I would have been dead because I was too weighty. I was big for someone like me because my BMI was high. So doing the surgery is a bit dangerous. So that's why they didn't do the surgery. That's why you don't need a surgery. You just keep managing. So that's what she said. I said, I don't care. I still need the referral. So she finally referred me to the hospital. Now, I don't have business with my GP anymore. Now I have business with the hospital. Waiting for the hospital to get back to me. By towards the end of the year, if I don't get back from the hospital, I should call them and find out what's going on. So, 2023 May, another tragedy happened to me. I lost my sister, one of my second elder sister. Grieving, the process, everything was just too much, and in that process moving home as well. So I wasn't even really waiting for the hospital to come back to me because I wasn't even ready for them, as of 2023. But by the time they got back to me, hospital, they got back to me in November 2023, telling me that my appointment for a pre-surgery is not even like probably pre-surgery, just my appointment with the gynecologist. It's been scheduled in March 15, 2024. I'm not like, so there's no appointment in December, in January, February, March, like literally. This was November, so I'm gonna have to wait for December, January, February, March, almost 4 months. If probably I got the letter in October, who knows? Like I have to wait that long to actually have my appointment with the gynecologist. Okay, there's nothing I can do anyway. That's the nearest appointment because there's backloads of people that needs appointment. Come January 2024, I made a total change in my lifestyle that no matter what, I am gonna do everything possible to just lose pounds. If it's 1 kg, 2 kg, I just want to lose something. I just want to see a difference in my life, not because of any, just for myself, literally. Because I tried that before. It was working until it did not work, until I lost my dad. That was in 2020. So I'm like, okay, I think I need to go again with full force and full determination. So I did that. Started January, commitment to the gym literally every day. I was doing some more exercises by swimming. Then I infused it with like intermittent fasting. So devoted. By February, I was seeing changes in myself, and I was my huge weight loss changing journey. When I started my diet in January, I literally weighed like 101 or 102 kg, and by February, I was weighing like 95 kg. Come March, so before March, my appointment that was scheduled around October, November 2023 to meet with the gynecologist regarding this whole fibroid and surgery situation in March 2024 was then cancelled, and it was now moved to June 2024. I'm like, why are you guys playing with me from March to June? Again, what can I do? And the reason is because the gynecologist is not around or blah blah blah. I even don't know. But what I do know was commitment with my weight loss journey. Coming March, I was really good. I think at one point I was like 90 kg. I said March, 90 kg. I was impressed with myself. I'm like, if I keep it up, I will end up going to like 80 kg. And if I keep it up, I end up being like 70 kg because I think I desire to be 85. But being 85, I just want my midsection to go down. I literally, if you see me, I have a skinny leg and a skinny hand. Maybe a little bit thick thigh, but not as thick as some ticky thighs. And, you know, the belly area, it is huge. Mind you, it's not just huge because it's huge because I be eating. I really don't know how to eat. And of course, I have store fats from long time. Store fat are a result of excess carbohydrate, excess sugar in the body. So store fat, and a very stubborn fat that refused to go. So they now rested at my lower abdomen. But sometimes my upper abdomen gets bloated, gets big. I'm like, I don't even know why my stomach is big, but that's what I know. So March ending, I had a lovely Easter weekend, spending with my sister home. We had some wine, we celebrated, happy. And towards March ending, I was seeing my period, and again, heavy bleeding and pain. In the first 3 days, I was in pain. And the Good Friday, I went out to celebrate a birthday with someone close to my heart, a little girl close to my heart, and I was fine. So that very Sunday, I was talking to my friend on the phone, and from nowhere, I was feeling dizzy. And I said, I feel dizzy. And she just probably said, oh, it could be your period. You know, you're bleeding, so it ends you feeling dizzy. So I drank a lot of water. I felt okay. And I went ahead to tidy up the kitchen because we cooked, arranged my stuff, did a lot of things at home, and I chilled in bed for the rest of the evening. Chilling in bed, not me taking a nap, just relaxing, playing games on my phone. That's me chilling in bed. So I was in bed, chilled. Of course, I've gone to toilet a couple of times during those chilling moments, and back to my chilling spot. And before you know it, it's 12 a.m., 1 a.m., 2 a.m. And because the next day is a Monday, it's a bank holiday, a good Monday, Easter Monday, so nobody's going to work and you're home, so you don't need to go to bed early. You just need to go to bed whenever you feel like. And I didn't feel like going to bed because I have this energy. And at 2 o'clock, my sister decided to come to, she's going to bed. Yeah, okay, that's fine. At 2:15, I'm like, you know what? Enough of this game. I need to take myself to bed because I'm going to be disturbing my sister with like the brightness of the phone. So let me go to bed. So I dropped my phone. My battery was low. I dropped my phone. Normally, I take my phone to the toilet regardless of any situation. But this time around, I'll be like, if I take my phone to the toilet, I'm going to keep playing that game. Just leave your phone in the bed. I left my phone in the bed. As I was walking around to go to the toilet, I felt weak. I felt tired. It's like I was dragging myself to go to the toilet. I don't know. It's like I could have just stopped and just wake myself. I'm tired. I'm that something. I don't know. But I said that, what is this? Maybe I'll get myself. So I managed to get to the toilet. I shut the door, but not like close it fully. I just shut it. And I sat on the toilet. The moment as I was touching the toilet seat, I could not even sit. I just prostrated and went on the floor. So I went on the floor, I started vomiting. I started vomiting fluid, water. I'm like, if I'm vomiting, I should be vomiting food because I had jollof rice earlier that day. But the time I had the food was 4 p.m. Could it be that the food is no more there? That's why there's water? This thing came in my head at that moment. Why am I vomiting water? Okay, I've been drinking water. Maybe I was vomiting water. So I felt like I can't stand up. I cannot move. What is going on? Why am I tired like this? I looked up. I saw the door shut. I'm like, oh shit. My eyes is closing. I'm like, oh shit. How can I call for help? My phone is not with me. So I was able to open the door at the bottom of the door because it wasn't shut fully. So I opened the door and I shouted my sister's name a couple of times. She did not hear me. I'm like, she's gone asleep. So the only way is to be banging the door. So I know I was banging the door like this, but it wasn't working. So I put my hand back inside in the toilet and started banging the door inside like this. I don't know what happened there. I think I kind of passed out. And the next day I could hear my sister calling, where are you? And I'm in the toilet. She found me on the floor. What are you doing on the floor? Are you okay? No, I'm not okay. I can't move. She started cleaning up the vomit. I was like, I need water. She gave me water. She's like, are you okay? Come to bed, maybe relax. You're going to get better. I was like, okay, give me malt. Give me malt to Guinness. I'm going to have strength or whatever to get up. She gave me malt. 1 minute after drinking a little bit of that malt, I vomited again. Okay, at this point, I'm vomiting from the front. I'm bleeding from the back. Period is going to period in. So, at that point, it hasn't occurred to her that something is really, really wrong with me. She was still shouting at me, get up. What is wrong with you? Why are you on the floor? Let's go to bed so you can relax. I'm like, I can't move. I thought to myself, this is not something I'm going to go to bed and sleep off. I need to go to the hospital because I don't know what's wrong with me. I told her to call the ambulance. Not even call 111 because it's more than 111. Call the ambulance. And she called 999 and ambulance department. And she was talking, but she wasn't talking as she was supposed to be talking. And then they wanted to speak to me. So the ambulance spoke to me. So I could be saying one word, answer a question. Are you bleeding from your head? No. Did you fall down? No. I went on the floor, but I didn't fall down. Did you bang yourself? No. Is that? No. Everything was no. And I was struggling to breathe. All this while, I was like... Maybe worse than that, but I was struggling to breathe. I was trying to catch my breath. And I noticed that me staying on my side, I could breathe. Me trying to get up, I don't know what's going to happen. And the lady was like, I'm going to get the doctor to call you. If anything serious again, something, call us back and we'll send the ambulance. I was just about no, I need the ambulance now. I can't even have that straight to talk. But because the phone was close to me, she could hear me breathing. She said, ambulance is coming. But, try to get the doctor, but ambulance is coming. I said, okay, thank God, ambulance is coming. So I was on the phone with her for 17 minutes. You know, I can remember. If my sister took a screenshot. And we called the ambulance around 3:43 a.m. I probably was already on the floor 1 hour before that, passing out. You know, ambulance department service, I don't know, they don't probably teach them eating signs of someone bleeding internally, you know. I don't think so, including the paramedics. So after that call lasted for 17 minutes. 5 minutes later after that call, the paramedics showed ambulance was outside. So before they came, that 5 minutes window, my sister managed to like help me to get up from the bathroom floor because it was so cold and freezing. I was cold, but I can't help it because I can't move. They went to like the hallway. That's the only step I could not go further. The hallway, I can't sit. I can't stay on my back. I only stay on my side, struggling to breathe. Ambulance came. The paramedics came, trying to find out what's wrong with me. I tried to explain myself. I just went to the toilet and that's it. I started vomiting. Okay, so they're trying to check my blood pressure. Because I was lying like this, like sideways, recovery position. So they have to check this side. So now my hand is like this, trying to check blood pressure. So they're not getting proper reading, or I don't know what they want to get. So when I check this side, I kind of move a little bit to check this side. I'm telling you, my experience with the paramedics that very day was not professional at all. Literally. So it's like, they didn't care. I'm that black person. What my sister told me is that they cared more about the beautification of the house than the patient on the floor. Meaning, you can see all these artworks. If you can see these artworks here, all over the hallway was loads of artwork. So they were more drawn to the pictures on the wall than drawn to the life on the floor. And the behavior towards me, because see, I'm someone that, if you're not professional, I will report you. Not report you like you need to lose your job. Just kind of like rate your conduct. Like, sorry, you're not that good. But I don't even have their time. Like, literally. So I was there struggling to breathe, but I could be thinking about their stupidness, what they were doing to me on the floor. So they were like, after I've explained my situation, there was no empathy. She was like, why are you closing your eyes? Open your eyes. I cannot open them. If I could open my eyes, I want to open my eyes, but I cannot open my eyes because I am struggling to breathe. I am weak. My eyes is closed, and the only time I get to open it is when I have a little bit of strength. I open it, but next in close, like close. Like, why are you telling me to open my eyes? If I can open my eyes, I open my eyes. Like, what is going on? Like, okay. And then the next day was like, oh, they're trying to fix cannula on me or something before they take me, or if they decide they wanted to take me to the hospital. And they realize that my vein is disappearing. I don't have any veins. So they'd be like, oh, and check my eyes, and oh, you're dehydrated. I was confused. I've never been dehydrated. So I don't know what dehydrated signs means, but whoever ever has been dehydrated, I don't think you should be struggling for your breath. So I was like, but I know I drank a lot of water on Sunday. Like, from where? Where did the water go? What's going on? So they decided to fix a drip of water on me. So as they were doing that, they can't find my vein. They poking me. Only God know where they poked me, and finally fixed cannula with a drip line on me. Think it's gonna work. 1 minute passed, nothing, and I think had a little bit of strain, and I could open my eyes and to close them. And they're like, oh, we need you to sit down. I was like, I can't sit down. They think I was pretending not to sit down, like I don't want to sit down, like I was making their life hell. I was like, I cannot even move, sit down. They said, oh, we can't touch you if you don't sit down. But if I sit down, I cannot hear what you're saying. I cannot breathe while I'm sitting down. If I lie on my back, I cannot hear what you're saying. They thought I was lying. So with the help of my sister, she pulled me up and I sat. Because they want to try and check my blood pressure. The moment I sat down by the wall in the hallway, I kept hearing ringing ringing sound in my ears. Everywhere is blocking out. I'm literally going like this. Everywhere is blocking out, and I cannot hear what they were saying. At one point, my sister was now shaking me. Jennifer. That shaky was waking me up because I was literally passing out. So then I went on my side. The moment I went on my side, I could hear them again talking to me. And the lady was like, I don't think we can do anything for you in the house unless you want to go to the hospital. Mind you, it's 5 hours away. You're going to stay in the hospital 5 hours. I was like, that's fine. I think before that's far, I'll be like, I don't even want to spend 5 hours in the hospital. But however, can I get better at home? Can they treat me at home? I'm not sure they have a lot of equipment to treat me at home. So you know what? When they said that, I was like, that's fine. You know, my sister got ready. They brought the stretcher bed. So I had to get up, have that strength. When the strength came, I get up, walk towards the stretcher, go on it. At this time, they were forced to strap me on my back. But at least I told them, as you strap me on my back, please raise the head of the bed up, you know. Then I can be able to breathe. So they did that. Put me in the ambulance. And I think before going to the stretcher, she wanted to wrap the drip and carry on my hand with a bandage. And like, so my hand was like this, resting. She was like, I was like, can I not just get to the bed, then you can do that? She was like, no, you have to sit up. Sit up, let me wrap it. I was like, no, okay, sit. Oh, Jesus Christ. Okay, she did that. Go on the bed, go into the ambulance, do whatever blood pressure machine was doing, checking the ambulance. My blood pressure was going down. We go to the hospital because the hospital wasn't quite far, like maybe 5-10 minutes drive. Got there, took me through the ambulance like area, left me in the hallway because you know they have to, like, there's quite a lot of patients, you know, you have to hand over to the nurses and doctors in the hospital, like, oh, this is the patient I brought in, this is what she's facing, you know. And I believe in their note, they probably said I was dehydrated. So meaning I wasn't a priority to them. So, and before they left, I said I felt sick. And they gave me, you know, a bowl. And I was vomiting brown. And one of the paramedics saw that, oh shit, this is serious. She vomited brown. She quickly took the vomit, the shit, I don't know where she kept it, got rid of it, and disappeared. Because to them, I was dehydrated. By the time I got to the hospital, I vomited brown. And they not saw that, oh, this is serious. But they were glad they also brought me to the hospital. While the whole way, I could see like 2 more people in front of me. I cannot see everything. It's whenever my eyes was opening, I was rubbing. So I could see like 2 more people in front of me, like, line up. And I'm like, okay, maybe not much. You know, it's not that busy. You know, I've been to quite a lot of A&E. You know, assisting people, and I see how bad it can be, how crazy situation can be, and people bleeding, like, you know. In my head, I'm like, because I'm not having physical injury, they may not believe my pain, so they may not take me serious, not take me so that they may not attend to me on time, or I'm not be given a bed or attending to. That was just in my head. But while in the hallway, I was struggling to breathe. I was moving from side to side in the bed, because from the ambulance stretcher bed transferred me to the hospital bed. So moving from side to side because there's no a position that was comfortable. I think my bed was a bit like flat, wasn't raised up, I'm sure. So there's no like position that was comfortable. Can't stay on my back, stay on my side, back side to side. So it was just a serious pain. So I was also having abdominal pain when touched, but it wasn't like pain, because mind you, 3 days ago before the incident, I was having stomach pain, but that is because of period pain. So I was still, because I'm seeing my period, so maybe that's the period pain I'm having, you know. But it wasn't like, oh, I can't breathe, my stomach hurts. Not situation. It was more like, I can't breathe, and there was like, are you having any pain? I was like, yeah. So it is not done to me now. I need to actually tell them I'm in serious stomach pain, you know, not to tell, but you get me. So while I was in the hallway tossing side to side, when you're tossing without tossing properly, if you're wearing a top, your top will get to move. So my pajamas was moving up, my trousers was moving down. So my torso was visible. Any specialists or doctors or nurses or support worker passing by, all they could see was my visible naked torso. Yeah. So that was bringing attention to me. So that was like, can we give her a blanket? Can we cover her up? So they went to get cover and cover me up. So I had my jacket with me at that time because I was really cold from the bathroom toilet. Even when I got to the ambulance, super cold. Good thing I was wearing a sock. And so I vomited the 4th time, but I was trying to get someone attention to tell them that I feel sick, but there was nobody by. So I had no choice but to puke all over myself, on that bed, and on top of my jacket. So I was literally wet. So by the time a nurse came to take my blood, did my blood pressure, they're looking for a vein, they can't find any vein. Before they were able to find a vein, fix a cannula on me, and then, take my blood, and then my blood pressure was going down. So she was concerned because I was breathing heavily. I was seriously breathing bad. So she was really concerned. And then she had to go and call someone, someone above her, and then, end up in a ward. So they came and rushed me to the ward. This point, they tried to find out what's wrong with me. I said, I don't know what's wrong with me. This is what happened. I was able to explain whenever I had the strength. They were like, oh, do you have any medical conditions? I said, no, I only have fibroids. That's the only thing I know, or PCOS, and I don't have anything that I'm not aware of. Okay. Are you feeling pain here? I said, yeah. Are you feeling pain? I'm feeling pain here. They'll be like, oh, we're going to do an x-ray, CT scan, ultrasound scan, to know what's wrong with you inside, because from outside, there's nothing wrong with you. When I was on the phone to the 999, they were like, have you lost any 2 liters of blood in the last 24 hours? How am I supposed to know that I've lost blood when I'm not physically injured? Like, I don't know the sense in that. Asking that question as if you're gonna know how to count. And only God knows how many liters of blood we lose all the time we're seeing period. And especially so when there is heavily bleeding for a couple of years, with fibroids. So I don't know how many liters of blood you must have lost. So by the time they take me to have an x-ray done, that was the first thing to the x-ray done. I was on my side. And before the x-ray done, because I was seriously wet, because they can't really know how to touch me, so they took off my pajamas, my jacket away, and they changed me to hospital gown, and immediately they fixed the catheter. The moment I felt catheter in me, I know that, oh shit, this is serious. Okay, CT scan and no x-ray. Bored me to x-ray and struggling to breathe, and they were taking a lot of time. The guy and the woman, because I know there's a man and woman in the x-ray room with me, they were taking too much time because they wanted to, I don't know what they were doing. So I was on my back for a couple of minutes so that they can get it done. And I could not breathe anymore. I was passing out. I went to my side, regain myself back. And the next thing, oh, please stay on your back. I stay on my back. And they say, oh, 5 minutes, stay on my back. The next thing, they're back to I don't know what they were doing. So because it was a frustrating situation for them and for me, the x-ray was not done. So they brought me back to the ward, a bit frustrated. Oh, we couldn't do the x-ray. So I tried to tell a doctor that it's not that I can't, I'm making things difficult for you guys. I can't breathe on my back. I can only breathe on my side. I can't hear what you're saying on my back. So, So while I was in the ward with quite a lot of doctors and nurses, because at that point they were doing handover of shift, because I could hear them explaining my situation and get to a group of doctors and nurses. I'm like, okay, there's shift changing, but I don't know what time it is or it was at that time. While they were talking, somebody came to do the ultrasound on my belly. I think I was lying a bit side flat like this, so they did like this, and they dig and they went this way, and they said, oh, you got water in your liver. Since when? The next thing, I think my blood result came back from the first time they took it in the hallway, and like, oh, a blood count is low or something. And the next time here, I think a doctor that is familiar with my situation came and like, no, she is bleeding internally. She's losing a lot of blood. We need to take her to the MRI operating room right now. And another nurse was like, oh, can we still get this x-ray done quickly to know what's wrong? And the doctor said, no, there's no time for that. Mind you, I was experiencing all this in that place in the ward with lots of doctors and nurses for my sake. And my sister was also experiencing that on outside the ward because she had to deal with her sister is in a serious situation. She had to deal with having to sign a consent form for me. She had to deal with having them to tell her it's 50-50. She had to deal with trauma of hopefully she does not lose me. Like, it's a crazy situation. And I'm in there trying like, oh shit, why am I having water? Is it the drip that those people gave me that came to give me water in my liver? What the hell? So a lady came to my head, like literally near my head. She touched my head. She came to my ear. She's like, Jennifer, you're gonna be okay. You're gonna be fine. We think you're bleeding internally inside. You're losing blood. We're going to give you blood. And we're going to open you up to stop your bleeding. You're going to be fine. Can you please stay on your back for me for 5 minutes? And I said, okay. The next day, they wheeled me to, I think I was on my back, and they wheeled me to OR, and I think it was so quick. I didn't even know how long, but it seems like it's a bit far, but it was quick for me. And they'd be like, you are in the operating room. So I kind of opened my eyes a little bit to like know what the operating room looks like every person. And I could see that light that you see on the Good Doctor, Grey Anatomy, even if I've not watched Grey's Anatomy, but the Good Doctor, those operating light, I could see above me. I'm like, and I can feel the time they were transferring me from the bed to the table, you know, because I helped them to move and shuffle a bit. While I was on that table, it was like, just stay on your back for me for a few minutes. And I stayed on my back. The next thing, they want to fix cannula on me. The next thing, my hands is strapped to the table. But hands is strapped to the table because at that point, I can't breathe anymore. So I was about to do what I normally do before. Turn to the side to breathe. I was like, can't move my hand. I can't even see, but I can't even open my eyes properly because like I've been on my back for quite some time. But I like trying to like just turn to like see my eye. I see like drip cannula and something strapped my hand. I can't even move it. Like, and then I can hear doctor above me telling nurses or whoever, can you prep the lemotiragen, something, prep the, I think it's one of those things that they use to sedate someone, or when you're going to surgery, whatever. I could hear that. I don't know if they were doing it because, yeah, that was the last thing I heard before I think I passed out, or I think I was unconscious, or I think they put me into a place where I can sleep. You know, they say when you're close to death, your life flashes in front of your eyes. My life did not flash in front of my eyes because death was never for me. So I was never close to it. You get me? I was far from it. So the only thing I was thinking was, I want to be okay. I wasn't thinking about my mom, my sister. I wasn't thinking I was going to die because I wasn't going to die. You know, so by the time I woke up, when I was waking up, I could remember in a place so dark, the escape route was up above me, so far away, and I could see a light, but everywhere was dark. It's kind of like those things that happen in Get Out, when the lady was that thing she was doing, is it it can't be hallucination, that thing she was doing, hypnotizing him, and he'll fall into that place. And when she rings the teacup, it comes back again. Exactly, that was where I was. I was in a place so dark and I could see a light above me, but it's still far I cannot reach. I don't know how. I think I was trying until I got out. So I think when I got to that place, that's when my eyes was opening. So my eyes opened and I looked around. I knew I was in the hospital. My memory was intact, and I look at the time. It was like 10 minutes to 2 o'clock, and there was a nurse beside me. And I looked at her like, "What's the time?" And she was like, "Oh, it's 2." As I was in the morning or in the night, because I think I've been in the hospital for 2 days, 3 days. God knows. She was like, "No, it's in the afternoon." Like I know this situation started at 2 a.m. for me, and I'm seeing almost 2 again. I wasn't so sure anymore at that time. She was like, when she said 2 in the afternoon, I'm like, oh shit, so 2 a.m., 3, 4, 5, 6, all the way to like 2 in the afternoon, almost like 12 hours later, I was fucking in the hospital. Yeah, so she said, you had a successful surgery. You know, we're going to get the doctor to come and tell you what they did. I was like, I don't know what they did. Okay. And I was like, first thing that came to my head was my sister. My sister must be waiting for me downstairs or whatever I was, you know, waiting for me, and I haven't come out and she hasn't heard from me. Can you please call her to go home, that I'm awake now, I'm okay? She called her. She said, you know, I could hear her in the speakerphone, and she said she's at home because the doctors told her to go home, like, or wake up in the afternoon, that she can come and see me when it's visiting time. So as I was rest assured, and she was assured, so I was just in and out of sleep at that time, because so from 2 o'clock I was sleeping. I woke up 4 p.m. sleep. Her like, can you please call my sister again if she's okay? And then, you know, because I was so high on the medication or the drugs they used in putting me to sleep throughout the operation, and coming out from it, and also high on morphine, so it's like the only thing I could do was sleep it off and wake up. Around, I think visitation came about 7 p.m. Before that, the first thing I wanted to do when I woke up was I wanted to wee. I was like, I want to use a toilet. How am I gonna get? She was like, you're fine. You have catheter in you. I was like, really? But I need to go to the toilet. And I know, like, you know, try and wee as if you're in the toilet. You're gonna come out. I didn't even know whatever I did because I was still pain in my lower stomach. So before then, my sister came. I was so thirsty of water. The first thing I also told her I need water. She gave me water. I was drinking water. I was, mind you, before the operation, I told them I need to drink water, and they said no, it's not going to be good for operation. So I didn't have the water. So when I woke up, that was the first thing I wanted to also drink after calling my sister. And so the doctor came for me, told me, oh, you had a successful surgery. Okay, we stopped your bleeding. We gave you blood. We took out your fibers. You know, we took out everything. You know, you're fine. I'm like, you say you took out everything. That means you took out my uterus. You took out my ovaries. It's like, what's the situation? She said, yeah. She said, yeah. And it was like she wasn't sure, but she's gonna get someone to come and tell me what has been done. So a gynecologist came, a lady, and explained to me, oh, your surgery was successful. Or you had a bleeding from a rupture or mesenteric vessel, so your fibroids was taken out. 3, one was big, one like a watermelon, one was like a potato head, and one was like an egg. So, but your uterus wasn't touched. Your uterus wasn't touched, and your ovaries are intact. Even one of the fibers was sticking with your uterus outside, but they were able to save your uterus because they had to call other specialists, and they were able to remove it. So you are fine. I was like, thank God, I'll be able to have kids, you know. Thank you for saving me, literally, because at that time I was just trying to process, oh, what this lady just told me. Literally, like, okay. My sister came around 7 p.m. for a visit. She was relieved. I was happy. Of course, she just faced a traumatic experience as well, you know, thinking she's going to lose her sister again, like for a second time, like literally, like what's going on. And then we called my mom, my older sister, on the phone. Everybody was happy and relieved. A big testimony. So yes, we're grateful to God. Later that evening, I was moved to another ward. I was moved to a critical care unit around that 11 p.m. critical care unit. So where I was in a ward of newly done surgery to recovery, and then going to recovery critical care unit where they're going to monitor your vitals to hopefully now you're getting better. So I was in critical care for like 3 days. The second day after the surgery, I had my physio trying to walk from the bed to the chair, try to use that belly muscle. It wasn't easy at all. I tell you, now we don't think about it, but we use our stomach in everything we do, and then what else again? I had good nurses, good doctors around me. So the nurses night and day for me at that unit was one nurse to part 2 patients, and they were really, really good. 5-star service in that unit, critical care unit. So in the first 3 days I was in the clear fluids, like can't even eat anything, just liquid. But I could smell some food, so my brain was already faster than my body. I was okay on liquid, so like I know I was doing fasting just the night before the surgery. Like the last time I ate proper food was about 4 p.m. on a 31st of March, and the next time I ate was like around on the 4th of April. So I fasted for so many hours I don't even know. Of course I had water in between, and after water, tend to have like juice, because every day they take my blood. I had x-ray done the first day and the night. They take my blood, check it to make sure my hemoglobin is okay because of the blood transfusion. They check my blood sugar level. It was low, because I didn't have been drinking water. So I had to start having juices and ensures. That was really good. Every morning I have specialist doctors, non-student doctors. I was literally like an example and experiment, but I'm grateful to God. Everyone talking, asking how am I doing and stuff. By 3rd day my catheter was removed. Oh my God, I was like, how am I going to be using toilet now? Because I wasn't comfortable on it, because catheter wasn't comfortable. I'm just like, with my stomach newly done surgery, moving is painful. And I know before the surgery, I used to go to toilet twice in 10 minutes or maybe less than that. So now that the catheter is off and I want to wee, it's going to be a struggle to get up and wee. But my body was just thinking of what my body had before, not knowing that I've really recovered from that surgery, kind of, because I was not keeping urine, trying to wait to keep it longer, and my bladder was getting full. Of course I had to exercise, like push myself, tell them I want to wee. So with the assistant of the nurse, had to use the commode. And yeah, so by then my body was like really good. Like 2 hours later I need to wee, not even 30 minutes anymore. So that body kind of switched and changed. It's just crazy, every day visit from my sister. My friend came to visit me as well with her kids. It was very emotional. Like the experience I'm reliving, talking about again, it's just so fresh in my head, like how everything just happened. On day 4 evening, I was now moved to another ward. That ward is where you get to progress in your health. You get better and you get discharged and you go home. I was thinking I was going to be hospital for like 2 weeks, because one of the doctor came and showed me the picture of my fibroids they took out, and also tell me that they're taking the fibroid to a lab. Hopefully 2 weeks time they'll know what is wrong, what happened, and they'll come and tell me. So I was thinking I was going to be hospital for like 2 weeks. Anyway, so yeah, moved to that ward. For the first night in that ward, I could not sleep because of the noises and the buzzer. Because mind you, where I was coming from, you could hear buzzer once in every 1 hour or so. And this time, like buzzing every minute. And sometimes the nurses, the support worker takes time to answer those buzzers, just because they're just busy doing something else, or they just can't be bothered, or they just want someone else to get to that place, because I was observing as well. you know, my help was just maybe I needed to wee because I have to get out of the bed because the bed was like, you know, the borders was up or the side barriers was up, you know, and I used the commode throughout the night. And in the morning I told myself, no, I'm going to go to the toilet, I'm going to push myself. So I had to, how far is the toilet? So I was assisted to the toilet, walking with assisting. I started walking on my own to the toilet myself, holding my balance, but sometimes I kind of felt like dizzy, like as if I want to fall. I was going to toilet myself, you know, whenever I needed to. I stopped putting the bars up. I stopped calling them for help, you know, to assist to get up. I was not pushing myself more because I was doing the physio exercises, you know, exercising my belly muscle, my legs, my hand, whatever it is I was doing to just keep myself getting up and going. So by the 5th, I was able to eat food, soft diet now. But even when the food came, I was not eating properly. Just 2 spoons, 3 spoons, I'm full. Like, I just wanted to smell the food. I just wanted to taste the food. That's what I was doing. And I was giving myself, wash myself, you know, clean myself, because while I was in the critical care unit, the nurses was cleaning me up, like washing me, and you know, because I could not move anything or do anything. And because of the surgery, there was still some bloods underneath my stomach, and then my period blood that I was almost finishing day like 5 or 6 blood, you know, all this cleaning. So I was cleaning myself on this day 5, shower, not full body shower, but hand shower, you know, and stuff like that. So by day 6, I was told that, oh, you're because every day you get rounds around the world where, you know, doctors and specialists come to check on you and see your progress, and they could see I was progressing good because I was working all the time. I was walking around the hospital, I was getting better, doing things myself. So by day 6, they said they wanted to take out the drain. I was like, no, like I can still see blood, I'm not seeing any clear liquid, can you take it out tomorrow? Okay, they agreed. So by day 7, which was the Sunday of that same week, I was not seeing clear fluid. So it was not like 100 ml anymore, it was like 50 or less than 50, but it was just water basic. So they finally took the drainage out in the evening of that Sunday, and I was supposed to be discharged that Sunday, but there was like mix up in the pharmacy, so I ended up staying extra day, not even a day, but extra night into the following Monday. So, you know, at the hospital, literally making a week. The first dressing after the drainage, I was still bleeding from the drainage section, and then the second dressings will be much better, and the head got discharged, went home. So I had to went to go and get my injection, my antibiotics, and you know, my codeine for pain when I'm at home, and lactulose for trying to like open my bowels, because this whole period my bowels hasn't come out yet. So I took my Fragile, which is an injection for trying to stop any blood clots in your stomach or your body, and tell you the meta frame of self-injecting is not here, because my sister couldn't inject me, so I have to be doing it myself. My god, it's crazy. I don't even know how I did it, but I finished that course. And also 2 days after I got home, my dressing was bleeding, so I took myself to the A&E. I walked there myself, and you know, they saw me, they redressed it, and you know, gave me antibiotics again. So that's what I was having on and progressing with exercises. I was going for walks. I wasn't lifting. I'm still not lifting now, but just doing something easy, something that I can do like I was doing before, just easy exercise and stuff. It's crazy. It's crazy. My sister was doing everything. I felt for her, you know, because we all normally do all these things together, every lifting and stuff, but she's the one having to do all of this. You know, I'm grateful to God for my health, for my life. You know, at home I was getting better, having food, home cooked food that I can enjoy, eating properly now. And I had a wound therapy section or appointment where, you know, they gotta redress me and check how my wounds is healing. Let me tell you, my wounds are healing fine and perfectly. You know, I'm all good and okay. You know, like I was told, even though I'm good on the outside and I'm healing fine on the outside, but inside may be different. So I should take things easy. don't push yourself too much. You know, that's what I've been doing. Just easy. Sometimes I push, but when I'm tired, like literally. April 1st and April 8th, I got home, and today is day 25. Wow, 25 days since my surgery and my recovery. I'm grateful to God I am here. My family are happy, everyone around me, my friends are happy. I'm grateful, like, for something to have happened to you, like, from nowhere, eternal bleeding, you know. I basically had a laparotomy and a myomectomy surgery, you know, and based on a bleeding from a ruptured or mesenteric vessel. You know, like, I think the fibroid kind of ruptured my inner stomach lining vessel, and hence bleeding everywhere. Like, I lost 3 liters of blood. I was giving blood transfusion. I was thinking, oh, my body's not going to take the blood. Oh, my blood is so rare because I am ROH positive or something like that. Crazy. And I did ask them, you know, I wanted to, like, speak to the lady that was talking to me when I was going to the theater, and, you know, up to today, those doctors and surgeons in charge of me, they are like angel to me, because I can't see them to tell them thank you, but I am grateful to them. And it's still mind blowing, you know. I was told I was dramatic, you know, dramatic because I needed an attention, because I don't know what's wrong with me. So I'm glad that dramaticness played out well, that I was attended to. I wasn't left on the ward with curtain shut. Oh, she'll be fine, you know. Crazy that I could tell them that this is what I have, this is my blood thingy. Crazy. But yeah, a lot of women face this, and this make me come to think that me losing my sister last year, she had the same thing. I don't know if she had fibroid, but the signs she was having, struggling to breathe, just like me, was just signs of internal bleeding. And because of where she was at that time, you know, the system wasn't that great. The doctors, they were not available, or surgeons, and it was just a fate, and waiting for good. But it turned out to be worse, because they had to wait for many tests to come out before they could decide what treatment. On my situation, all the equipment are available. The professionals, they are available. The test they needed to do was instant results. So I'm grateful that I'm alive, but I lost my sister last year. It took our symptoms to know the same symptoms with mine, to know what internal bleeding looks like or feels like when you see someone hyperventilating. And a lot of people don't know signs of internal bleeding, just like the operators on the 911 was like, on the 99, just like the operators on the 99 call was like, have you lost any blood? How do you want me to know if I've lost any blood? Like, literally, even if it's period blood, how do you want me to measure it? Or they could tell, like, oh, if you're having stomach pain and you're bleeding and you're having fast breathing and struggling to breathe, could be sign of something bleeding internally. Or the paramedics, if they have that kind of training, they will know how to prioritize how important somebody is for treatment, not thinking that they are pretending, not thinking that they are dehydrated just based on what they could see. It could be more than that, you know. Anyway, I am here to tell you the story. I'm yet to share my experience. I am yet to be grateful. So I'm grateful to God. I keep saying it can only be God. I'm gonna have a t-shirt when I say it can only be God, like nobody else. Thank you very much for taking your time to listen to this video. Anyway, in my next video is gonna be me reviewing makeup, or me reviewing a skincare product, whatever it is that comes my way. Okay, until then, I'm gonna see you in my next video. Bye.